Question 1. Which cancer patient should the nurse assess first at the beginning of the shift? A. 50-year-old receiving chemotherapy who reports nausea. B. A 70-year-old with lung cancer reporting shortness of breath. C. A 60-year-old scheduled for radiation in 2 hours. D. A 45-year-old with fatigue due to anemia. Answer. B. A 70-year-old with lung cancer reporting shortness of breath. Question 2. Which task is appropriate for the nurse to delegate to the unlicensed assistive personnel, UAP, caring for a client with neutropenia? A. Administering oral antibiotics. B. Educating the patient about hand hygiene. C. Reporting the patient's temperature. D. Assessing for signs of infection. Answer. C. Reporting the patient's temperature. Question 3. A client receiving chemotherapy reports new onset of oral ulcers. What is the nurse's priority action? A. Administer antiemetic medication. B. Provide a soft toothbrush. C. Notify the healthcare provider. D. Encourage increased fluid intake. Answer. C. Notify the healthcare provider. Question 4. A nurse is caring for 4 clients. Which client should be assessed first? A. A client with a new diagnosis of leukemia reporting bone pain. B. A client with breast cancer who has a WBC count of 2,000/mm superscript 3. C. A client with colon cancer scheduled for chemotherapy. D. A client with prostate cancer reporting difficulty urinating. Answer. B. A client with breast cancer who has a WBC count of 2,000/mm superscript 3. Question 5. Which action by the nurse is most appropriate when caring for a patient with thrombocytopenia? A. Administering IM injections. B. Encouraging the use of a razor for shaving. C. Placing the patient on bleeding precautions. D. Applying heat to bruised areas. Answer. C. Placing the patient on bleeding precautions. Question 6. The nurse receives 4 patients on the oncology floor. Which patient is the highest priority? A. A patient with a new diagnosis of lymphoma awaiting biopsy. B. A patient with chemotherapy-induced nausea and vomiting. C. A patient with leukemia who has a fever of 101.8 degrees Fahrenheit. D. A patient with stable vital signs reporting fatigue. Answer. C. A patient with leukemia who has a fever of 101.8 degrees Fahrenheit. Question 7. Which of the following actions is best to delegate to a licensed practical nurse, LPN? A. Teaching a patient how to prevent infection. B. Administering for chemotherapy. C. Monitoring for adverse effects of oral chemotherapy. D. Developing a care plan for a neutropenic patient. Answer. C. Monitoring for adverse effects of oral chemotherapy. Question 8. Which client would most benefit from hospice care referral? A. A patient with breast cancer undergoing surgery. B. A patient with terminal pancreatic cancer with pain and anorexia. C. A patient receiving curative chemotherapy for leukemia. D. A patient newly diagnosed with stage I lung cancer. Answer. B. A patient with terminal pancreatic cancer with pain and anorexia. Question 9. A nurse is assessing a patient receiving chemotherapy. Which finding requires immediate attention? A. White blood cell count of 3,800/mm superscript 3. B. Platelet count of 90,000/mm superscript 3. C. Urine output of 300 milliliters in 8 hours. D. Temperature of 100.9 degrees Fahrenheit, 38.3 degrees Celsius. Answer. D. Temperature of 100.9 degrees Fahrenheit, 38.3 degrees Celsius. Question 10. Which task is most appropriate for the registered nurse to delegate to the UAP caring for a client receiving radiation therapy? A. Assessing for skin breakdown at the radiation site. B. Educating the patient about radiation side effects. C. Assisting with bathing and hygiene. D. Monitoring the client's emotional response. Answer: C. Assisting with bathing and hygiene. Question 11. Which nursing intervention is the highest priority for a client at risk for tumor lysis syndrome? A. Monitor for signs of infection. B. Administer 4 fluids as prescribed. C. Evaluate pain level regularly. D. Educate about chemotherapy side effects. Answer: B. Administer 4 fluids as prescribed. Question 12. A cancer patient is experiencing severe bone pain. What is the nurse's first action? A. Offer distraction techniques. B. Assess the pain level and location. C. Administer prescribed acetaminophen. D. Notify the provider immediately. Answer: B. Assess the pain level and location. Question 13. A client undergoing chemotherapy has a hemoglobin of 7.8 G/DL. What is the nurse's most appropriate action? A. Recheck the lab in 4 hours. B. Encourage the patient to ambulate. C. Prepare for a possible blood transfusion. D. Withhold chemotherapy treatment. Answer: C. Prepare for a possible blood transfusion. Question 14. Which of the following patients should the nurse prioritize? A. A patient with nausea after chemotherapy. B. A patient with colon cancer with no bowel movement in 2 days. C. A patient with multiple myeloma reporting new onset confusion. D. A patient with breast cancer and alopecia. Answer: C. A patient with multiple myeloma reporting new onset confusion. Question 15. The RN is supervising an LPN and a UAP. Which task is appropriate for the UAP to perform? A. Monitor 4 fluids for a client receiving chemotherapy. B. Report the client's intake and output. C. Educate a client on neutropenic precautions. D. Assess a client's mucous membranes for ulcers. Answer: B. Report the client's intake and output. Question 16. Which nursing intervention takes priority in the care of a patient receiving radiation therapy? A. Encourage high-protein diet. B. Monitor for diarrhea. C. Assess skin integrity at the treatment site. D. Promote fluid intake. Answer: C. Assess skin integrity at the treatment site. Question 17. A patient receiving chemotherapy reports a sore throat and fatigue. What should the nurse do first? A. Assess vital signs and obtain a temperature. B. Administer prescribed analgesics. C. Encourage rest periods. D. Notify the provider immediately. Answer: A. Assess vital signs and obtain a temperature. Question 18. Which patient should the oncology nurse assess first? A. A client with prostate cancer reporting frequent urination. B. A client with breast cancer and neutropenia reporting chills. C. A client with leukemia receiving a blood transfusion. D. A client with colon cancer with mild abdominal discomfort. Answer: B. A client with breast cancer and neutropenia reporting chills. Question 19. What is the most appropriate intervention for the nurse caring for a patient with mucositis from chemotherapy? A. Offer citrus fruits. B. Encourage alcohol-based mouthwash. C. Provide frequent oral care with saline rinse. D. Suggest hard candies to relieve dryness. Answer: C. Provide frequent oral care with saline rinse. Question 20. Which client is most at risk for developing superior vena cava syndrome? A. A client with advanced ovarian cancer. B. A client with small cell lung cancer. C. A client with prostate cancer. D. A client with acute lymphoblastic leukemia. Answer: B. A client with small cell lung cancer. Question 21. Which assessment finding in a client receiving chemotherapy requires immediate intervention? A. Hair loss and scalp tenderness. B. A blood pressure of 100/60 mmHg. C. A platelet count of 18,000/mm superscript 3. D. An oral temperature of 98.7 degrees Fahrenheit 37.1 degrees Celsius. Answer: C. A platelet count of 18,000/mm superscript 3. Question 22. Which task can be delegated to the LPN in the care of a cancer patient with neutropenia? A. Perform initial assessment for signs of infection. B. Teach the client how to avoid infection. C. Administer oral antibiotics. D. Interpret laboratory values. Answer: C. Administer oral antibiotics. Question 23. A patient is diagnosed with SIADH secondary to lung cancer. Which action is a priority? A. Encourage oral fluid intake. B. Place the patient on a low-sodium diet. C. Monitor serum sodium and restrict fluids. D. Prepare the patient for radiation therapy. Answer: C. Monitor serum sodium and restrict fluids. Question 24. The nurse is preparing to administer chemotherapy. Which action is most important before starting the infusion? A. Ensure the client has eaten breakfast. B. Educate the client about hair loss. C. Verify patency of the foreaxis. D. Administer antiemetic medication. Answer: C. Verify patency of the foreaxis. Question 25. Which client requires immediate follow-up by the nurse? A. A patient with melanoma reporting itching. B. A patient with leukemia with petechiae and bleeding gums. C. A patient receiving radiation therapy complaining of dry mouth. D. A patient with bone metastasis experiencing chronic pain. Answer: B. A patient with leukemia with petechiae and bleeding gums. Question 26. Which task is most appropriate to delegate to the UAP for a client receiving palliative care for terminal cancer? A. Monitor the client's response to pain medication. B. Provide mouth care and reposition the client. C. Teach the client's family about comfort care. D. Assess for signs of impending death. Answer: B. Provide mouth care and reposition the client. Question 27. A client with cervical cancer is experiencing anxiety and depression. What is the nurse's best initial intervention? A. Recommend medication for depression. B. Suggest the client join a cancer support group. C. Refer to psychiatry immediately. D. Encourage verbalization of feelings. Answer: D. Encourage verbalization of feelings. Question 28. A client receiving chemotherapy has an absolute neutrophil count ANC of 400/mm superscript 3. What is the nurse's priority action? A. Restrict visitors and monitor for infection. B. Encourage a high-protein diet. C. Begin oxygen therapy. D. Provide antidiarrheal medication. Answer: A. Restrict visitors and monitor for infection. Question 29. A nurse is teaching a client with stomatitis from chemotherapy. Which statement indicates understanding? A. I will use a firm toothbrush after meals. B. I can rinse my mouth with warm saline frequently. C. I should use mouthwash with alcohol to reduce bacteria. D. I will eat spicy foods to stimulate appetite. Answer: B. I can rinse my mouth with warm saline frequently. Question 30. Which action is most important when caring for a client with a sealed internal radiation implant? A. Stand at the foot of the bed when providing care. B. Stay in the room with the client as long as possible. C. Limit visitors to 10 minutes and maintain distance. D. Encourage family to stay overnight. Answer: C. Limit visitors to 10 minutes and maintain distance. Question 31. A patient receiving chemotherapy develops tumor lysis syndrome. Which lab value requires immediate action? A. Potassium 6.5 milliequivalent/L. B. Phosphorus 3.5 milligrams per deciliter. C. Calcium 9.0 milligrams per deciliter. D. Creatinine 0.9 milligrams per deciliter. Answer: A. Potassium 6.5 milliequivalent/L. Question 32. The nurse is teaching a patient receiving external radiation therapy. Which statement needs further teaching? A. I will protect the skin from sunlight. B. I will use only mild soap and water on the treatment area. C. I will apply lotion to keep the area moist. D. I will not scrub the area that is being treated. Answer: C. I will apply lotion to keep the area moist. Question 33. Which nursing diagnosis takes priority for a client with metastatic bone cancer and hypercalcemia? A. Risk for infection. B. Impaired physical mobility. C. Risk for injury related to confusion. D. Disturbed body image. Answer: C. Risk for injury related to confusion. Question 34. Which client condition is most concerning to the nurse during chemotherapy administration? A. Mild nausea after infusion begins. B. Slight tingling in the fingertips. C. Redness and swelling at the foresite. D. Hair loss noted on pillow. Answer: C. Redness and swelling at the foresite. Question 35. Which task should the nurse delegate to an experienced LPN caring for a patient with breast cancer? A. Perform admission assessment. B. Administer oral pain medications. C. Evaluate the client's coping strategies. D. Develop a discharge plan. Answer: B. Administer oral pain medications. Question 36. A patient with leukemia has a WBC count of 1000/mm superscript 3. Which menu item is most appropriate? A. Fresh fruit salad. B. Caesar salad with raw egg dressing. C. Toast with peanut butter. D. Sushi with avocado. Answer: C. Toast with peanut butter. Question 37. Which action should the nurse take when caring for a client with suspected spinal cord compression from metastatic cancer? A. Encourage mobility and deep breathing. B. Elevate legs to promote venous return. C. Notify the provider and prepare for MRI. D. Restrict fluids to reduce edema. Answer: C. Notify the provider and prepare for MRI. Question 38. Which assessment finding in a client with lung cancer suggests superior vena cava syndrome? A. Increased urinary output. B. Distended neck veins and facial swelling. C. Crackles in lower lung fields. D. Clubbing of the fingers. Answer: B. Distended neck veins and facial swelling. Question 39. A patient on chemotherapy reports fatigue and dizziness. Which lab value supports the nurse's concern? A. Hemoglobin 7.5 G/DL. B. WBC 5000/mm superscript 3. C. Platelet count 180,000/mm superscript 3. D. Sodium 138 milliequivalent/L. Answer: A. Hemoglobin 7.5 G/DL. Question 40. The nurse is reviewing safety education with a cancer client receiving radiation. Which statement by the client indicates a need for further instruction? A. I will wear loose-fitting clothing over the radiation site. B. I can use a heating pad to relieve soreness. C. I will avoid swimming in chlorinated water. D. I'll protect the area from the sun. Answer: B. I can use a heating pad to relieve soreness. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.